Hi, this is Dr. Ramin Tayani, oculoplastic specialist and board-certified ophthalmologist at the Tayani Institute. Welcome to our YouTube channel. Today we're going to talk about brow lifts, eyebrow lifts. There are several different ways of doing a brow lift. In fact, I'm going to talk about I'm going to step back for a moment and talk about when a patient comes and sees me for an upper eyelid droop, because typically patients don't come in and say, I need a brow lift. So a typical patient comes in and says, my eyelids feel heavy, I have feeling of droopiness, or I feel heaviness in my brows. When I evaluate the patient, there are three causes of a droopy lid. The brow can push down, make it look heavy. You can have excess skin on the eyelid, or it could be an actual muscle problem where the muscle disinserts from the cartilage of the lid and the lid starts drooping downward. Any one patient can have any one or all three of those problems. It could be the brow, it could be excess skin, or it could be a muscle of the eyelid. Let's assume, since this discussion is about brow lifts, that the problem is either only the brow or a combination of the brow and something else. So when we're talking about brow lift, there are several ways of doing a brow lift. The easiest, simplest way is to make an incision right above the hair of the brow, either the full brow or just the tail of the brow, and remove the excess into the forehead and lift up the brow. However we want to do it, whether it's the full brow or the tail of the brow. Many times a tail of the brow lift is just as well, if not better, than just do the full brow lift. So a direct brow lift would be that. Another way to do this is called a coronal brow lift, which we go from ear to ear across the whole scalp and remove a chunk of that tissue and pull everything up. That is a procedure we used to do years ago. We're doing less and less of that. I probably do one about every 5 years of a coronal brow lift. The other procedure is to go same as the direct brow, but we do it in the front of the hairline, called a pre-tracheal brow lift. That's a great procedure and is probably my preferred procedure to do, where we can get a very good brow lift without the scar of the upper brow area. And then the last procedure is using an endoscopic technique. With an endoscopic technique, we use 5 incisions, small incisions in the midline, 2 in the paramedian, and 2 in the temple. And we use a telescope, a special camera that goes underneath the skin, does all the work, pulls everything up, and it can hold it up if we have a good dissection underneath the brow. So, in summary, the direct brow lift, the pre-tracheal lift, coronal lift, or endoscopic. I'm going to give you the pros and cons. The coronal lift I rarely do, so I'm not even going to talk much about that. The direct brow lift is a great procedure for mostly men, because a lot of us have forehead lines, and if we're raising our eyebrows, we can generate more lines. The scar is the big negative of a direct brow lift. However, the scar can be minimal, but I always tell patients you need to know that there's a potential of a scar, a line right here, that could be equal or worse than any of the forehead lines. So I usually don't recommend that for a younger female or someone who's very interested in a great cosmetic result. For a functional lift, the direct brow lift is a fantastic option. It's quickest, it's the least expensive if you're paying out of pocket. The pre-tracheal is the second best in terms of how much lifting we can get and minimizing the scar, because the scar is right in front of the hairline or can be hidden in the hairline. And we can angle that whichever way we want. If we wanted to get a full brow or again just a tail of the brow, we can just angle that pre-tracheal incision further, what we call lateral or temporal, away, closer to the ear as opposed to the center of the face. The endoscopic technique is great with the most amount of cosmetic benefit. However, it does take the longest and it is the most expensive. And sometimes between the endoscopic technique and the pre-tracheal, there's really not that much scar saving advantage. So I would push into the pre-tracheal approach. The postoperative course of a brow lift could include a dressing that goes around the forehead. If that happens to be the case, you do expect to have some form of a headache the first day or two, and sometimes that dressing will be totally around the forehead and even come around the below the neck to help secure that dressing. Usually we keep that on for a day or two. Most of my patients, I do not need to do a dressing of that sort, and you just put an ointment, any type of antibiotic, big tube, I call it, antibiotic ointments, not the little ones that we use for the eyelid and for the eye, is fine. You can use a triple antibiotic, a bacitracin, anything like that that you have at home or you can get over the counter. Apply that to the wound incision line, either here or here, 2 to 3 times a day for the first week to 10 days. If there are sutures or staples in place, they usually come out anywhere between 6 to 10 days after surgery. Typically, the pain is minimal. Tylenol is all we expect to need, but if you needed more, we typically do give some form of narcotic that you can use a few tablets for the first day or 2 if needed. It's rare that you would have significant pain. This pretty much completes the procedure about how, what type of brow lifts exist and what to do for the aftercare of a brow lift. Again, Dr. Tayani from the Tayani Institute. Have a great day. Till next time.